I am so thrilled to announce Heidi Arthur, the Chief Campaign Development Officer at the Ad Council, to the stage to discuss the incredible, scalable work they have done to impact both youth and adult mental health. So please help me in giving Heidi a very warm welcome.
That last panel made me miss my daughter so much. I just told Dr. Alfie I needed a few minutes. Well, thank you for having me here today. It's an honor to just be among so many people that are doing such great work to tackle what we know is one of the biggest crises our country's facing at this moment in time. And I don't have to talk about the statistics here because you're all incredibly well versed. It's heartbreaking, it's staggering, but it's inspiring that so many people are here with a common goal to really do whatever we can where we sit in the world. So when it comes to the Ad Council, that's a big question that we always ask ourselves. When we look at these complex issues, where can we make meaningful and measurable impact? And over the years, we've become very passionate and have always been passionate about using the power of communications to really take on some of the most critical, complex issues facing people in our country and drive measurable change, really open up hearts, minds, and souls to think and do differently. And some of our campaigns over the years that you might be familiar with are Smokey Bear, Friends Don't Let Friends Drive Drunk, as well as Love Has No Labels, an Emmy Award-winning campaign around promoting diversity, equity, and inclusion. So when it comes to mental health, it's not as simple as we all know. You can't just buckle your seatbelt, you can't take the drink out of a friend's hand, you can't do a risk test to see if you have prediabetes. So we really spent considerable time figuring out what can we do to change culture, how do we look at who's most impacted in this country, and then drive meaningful change. Everything we do is expert informed, and Dr. Alfie, we're so grateful for her expertise that she's lent to our initiatives. And it's important for us to make sure that we're really talking to leaders and stakeholders in the field so that we're using where we sit in the world in a very judicious way. Because our model is very unique, and I think I mistakenly, not ready for that. We're really a place, a nonprofit organization that brings together the best storytellers in our country to create new narratives, again, to drive measurable and meaningful change. We also are fortunate to have media partners that represent all platforms and channels who also want to use where they sit in the industry to make a big impact, and they've really stepped up. And over the past year, we've had over $1 billion in donated media. So that brings a huge opportunity and responsibility to use it well, use it wisely, and to make sure that what you're doing, again, is designed to make meaningful change. So when it comes to mental health, we know it's definitely not a one-size-fits-all model. And we have multiple initiatives underway in this space, and we've made a big commitment organizationally to really focus and go deeper and do more to drive meaningful change in this area. So I'm going to talk more specifically about a few campaigns, but what you'll see is that it's all about changing culture. They all ladder up to a common North Star and goal, which is to truly create a society that's more open and accepting and proactive when it comes to mental health. And it's about understanding the nuances of different communities, understanding what's getting in the way of people self-identifying or say, hey, I feel like my friend or neighbor or colleague might be struggling, but I don't feel like it's my role to step up and do something about it. So we have to spend time, we have to dig deep, we have to do the research to understand how we're really going to get underneath it all. So the good news is we're working with incredible partners in this space, and some of them are here today, like the JED Foundation, Pivotal Ventures, as well as the VA, the American Foundation for Suicide Prevention, as well as the Huntsman Mental Health Institute. And we have 4 initiatives, each designed for different audiences, because again, we can't do one size fits all. It's just not Smokey Bear standing out there telling you to put out your campfire. Not that it's not important and wildfires aren't a significant environmental threat, but it's a lot easier to figure out what to do. So again, a big tent with multiple initiatives. The first one that I'm going to talk about is called Sound It Out, and it's largely focused on parents and caregivers of young kids all the way up through middle school. And we partner with Pivotal Ventures on this initiative, and they came to us a few years ago, this was pre-pandemic, and said, there's a crisis happening there. I mean, if you look at the rates of anxiety, depression, suicidal ideation, emergency room visits among young kids, what can we say, what can we do in the world of communications? And that's our job. We can't fix the systems, we can't get more healthcare providers out there, particularly in communities of color, but we can close the gap between information and access and the availability to know where to go and what to do. So for parents of middle school age kids, we focus primarily out of the gate on Black and Hispanic families, and we needed to figure out how do we get parents to prioritize mental health and wellness and to regularly check in on their kids. And we did a lot of research and talked to a lot of experts, including Dr. Alfie. And what we heard pretty much across the board from many parents, and many of you here might be able to relate to it because it was kind of a universal insight. Well, if something was wrong, I would know about it. I ask them how they are, and they say, I'm fine. So how do you really dig underneath and get beyond I'm fine to truly understand what's going on in your child's heart, in their mind, in their soul, so you can be a support system and be that first line of defense? So I'm going to share some work that really shows how we designed a campaign that uses the power of music, which is inherently emotional, opens up dialogue and conversation to help parents really enter that world with their child. And then importantly, it doesn't stop there. We drive them to content that's really curated by talking to experts that educates parents on signs and symptoms, as well as what to say, where to go, what to do around certain circumstances. Everything's organized by emotions your child might be feeling, or situational events that are happening in school, or maybe in your own home that you're not quite sure how to deal with. So the other important part of the equation, beyond just cultural relevance and insights, is to understand who are the most trusted voices. So the first spot I'm going to share with you is a very trusted voice for parents of young children in this country.
How you feel on the inside is just as important to me as how you feel on the outside.
Oh, Daddy.
I'm grown up, everywhere in every way. Care and take care of you. You're my grown up, and I know you're there.
I'm a grown up, and you know I care.
'Cause it's you and me and me and you.
So when you are okay or not okay, I'll take care of you.
So again, really trusted voice. And it's not just about one piece of content. This is just representative. There's a digital experience, and then Sesame has a lot of other video content and programming designed to continue this conversation with parents and families. The next piece of content, again, focused on parents and caregivers, was done in partnership with Amazon. And as I said earlier, we've got a lot of partners in the media and tech world who want to use where they sit to derive meaningful impact, and they invested a lot in a partnership on this particular issue. So again, drawing on that insight of music really has the power to open up conversation between parent and child. We collaborated with them on a very unique digital experience where through Amazon and Amazon Music, parents can search for songs out of their 100 million song library based on emotion, and then ask Alexa, or you can do it digitally on your phone, to please share this song with my child. So again, it's very circumstantial. It's an opportunity to start that dialogue, and then providing more resources and tools for parents to have the right conversation. And I'm going to show you just a short piece of film that many of you may be able to relate to, of that moment in a car when you really want to reach out to your child and you're just hitting a wall. So let's take a look.
I have to go. Talk to me. Isa.
So again, it's really understanding your audience, looking at the data, where's the highest need, and at the time when we developed this content, the CDC had released new data showing, the higher rates of anxiety, depression, suicide ideation among Hispanic girls in particular, and we were looking at our own data that we track on a regular basis and didn't see the needle moving as quickly against this audience, so really leaned in heavily into this partnership. And I encourage you to go take a look at it on Amazon, and the results were extraordinary. They put about $1 million worth of donated media to make sure that that was actually seen so that people could get access to it, and the video had over 10 million completed views. I mean, think about how many things you scroll through, you watch a few seconds, then you kind of move on. 10 million completed views, as well as over 11 million audio versions of that. And this is all laddering up to, what we're seeing in terms of statistically significant shifts among this audience. So this is working off of that same insight. Music has the power to foster conversation between parent and child to get beyond "I'm fine." Having multiple partners really work off of that research-based, expert-informed messaging strategy, and we're seeing the needle move. We've had over 3 million visits to the Sound It Out Together website, which provides a lot of content for parents around warning signs, what to say, what to do, where to go, as well as statistically significant shifts in attitudes and behaviors among parents, particularly among Black parents and Hispanic parents, where they are now frequently reporting checking in on their children around their emotional health and well-being at much higher rates. The next campaign I'm going to talk about is work that we do in partnership with the JED Foundation and the American Foundation for Suicide Prevention. And it's tackling, again, the heartbreaking story that we're seeing among young people, in our country. And we're talking about teens, that 16 to 24-year-olds where, sadly, suicide is the third leading cause of death, but the good data that we took a look at and really designed this work around, focusing in on where can communications make a difference, is that 76% of young people who are struggling will often turn to a friend for support. So how do we take that and really use it as a way, again, to provide meaningful support so that people aren't suffering alone, so that friends could regularly check in on their friends? And that's the goal of this campaign. We did, again, a ton of research to figure out what are the barriers. There's lots of talk around mental health. You heard today, young people are really open and honest about it. But when it comes to sometimes sharing or feeling like you know enough to step up and intervene, there's a lot of concern around doing more harm than good, or people check in once and then assume you're fine and don't check in again. So this is really designed to motivate and inspire friends to check in on their friends regularly, to know what to say, what to do, and then how to provide that ongoing support. And then, of course, if someone's in crisis, who to call, who to text, and what to do with that. So I'm going to just share with you just what we call our base campaign, which is a piece of content which really is designed to put the narrative out there.
I don't know why you're so sad. You've got a roof over your head.
You gotta stop with that depressing stuff. That's what white people think. You alright?
It just feels like it's coming from everywhere.
Do you wanna talk about it?
You can talk to me if you're feeling sad.
Whenever you need to talk, I'm here, okay?
Again, kids helped design that. It was really reflective of what people were experiencing in their own home. It was very honest and real, and it's been doing very well in terms of, recall and people really understanding, internalizing the message. The other thing that's important to consider with this audience is, who are those trusted voices? And we know that authentic stories from people with sizable platforms can really help drive the conversation in a good way on digital and social channels. So the next piece of content I'm going to share with you was done with Megan Thee Stallion, and we've done others with people like Caleb Williams, who's the USC quarterback, who many of you may have seen this past weekend, hugged his mom when he lost and cried, and, it was promoted to just help normalize this behavior. We've worked with artists like Billie Eilish, who take our briefs to heart, who want to go out there with safe messaging and the right messaging and create wonderful content. So let's take a look at Megan Thee Stallion.
I've always been told I gotta be strong. Thick-skinned, stiff upper lip, tough as nails. But to be everything for everybody, it wears on you. Black don't crack, they say. But it can. I can. We all can. Y'all, it's okay to not be okay. Reach out to a friend if you see them going through it. No matter who you are, being vulnerable is what makes us whole. Learn how to help at seizetheawkward.org. And check out badbitcheshavebaddays2.com for even more resources, Heidi.
And I will not be offended if you all take out your phones right now and check out Bad Bitches Have Bad Days Too. It's worth it. It's great content and promotes, a lot of trusted, vetted resources. And, they were very responsible with her voice on this issue, and she's been out there very authentically showing up. So again, when you have an expert-informed, research-based strategy and you consistently promote it where people are through the voices that they really care to hear from, it can move the needle. We've also done, extensive extensions in digital and social and tech with TikTok, where again, we hand them that same brief. You've got a platform, you've got a voice. Here are the 3 things we would love for you to share around how to have a conversation, modeling that conversation with your friends, and then promoting the resources at seizetheawkward.com. And just recently, we did some content with Black, Hispanic, and LGBTQ creators on TikTok and had over 10 million views. And we know, again, trusted voices, trusted partner. We also did a partnership with Reddit, which, again, I think I might have some visuals of that. It's kind of hard to see here, but we had a mega thread on Reddit promoting those Seize the Awkward messages, pulling a lot of the content that's on the website, because we know a lot of kids are not going to websites, so how do you really make it endemic to where they are on digital and social channels? So right there in Reddit, you could see what are the warning signs, really in real talk, like situational things that college kids can relate to, what to say, what to do, and importantly, where to go if you think that there's a crisis happening there. And according to Reddit, the click-through rates and the engagement on that particular piece of content blew their norms out of the water. So we're doing similar things with partners like Pinterest, all around have the conversation, how to have the conversation, and then leveraging those kinds of tools like calendar reminders. We all get busy, but you really want to check in on that friend again, so it allows you to pin things in a way that, makes sense for those that really use those platforms as part of their daily lives. So again, it all ladders up to a common message, a common platform, customized for audiences, as well as these digital and tech platforms, and we're seeing the needle move. We've had over 3 million visits to the website, over 60 million views of our content, again, content from Megan Thee Stallion, Caleb Williams, Billie Eilish, the pre-produced videos that you've seen. And then we're seeing statistically significant shifts. And we look at data based on those who are aware of our campaign and those who are not aware of the campaign and have seen the needle move dramatically more among those who, again, have engaged with and seen this content. The other thing I'm going to talk about, even though this is about youth, I'm going to talk about adults, because we all know how important it is for kids to have adults that are taking care of themselves first and foremost. Put your oxygen mask on first is something that we all know very well, but often we don't practice. But it's so important to understand, who's most at risk in our country, what are the different messages that we have to be, careful to put out into the world. And I'm going to share some work that we do with the VA around VA suicide prevention. The rates of suicide among our nation's veterans, again, all this stuff makes you hold on to your heart. I think it's 57% higher than non-veterans. It's just unacceptable, but understandable when you look at the world that many are facing with joblessness, sleeplessness, relationships falling apart. So we did our research like we always do, talk to experts, talk to veterans throughout the process, and heard, very loud and clear, very noble, service before self. I'm the first one to raise my hand if a fellow veteran says, "Can you help me?" But when was the last time I actually took that advice myself? So the piece of film that I'm going to share with you features real veterans sharing their own experience, and we were so fortunate again that so many people in our country care deeply about this that Catherine Bigelow, the Academy Award-winning director, created this film for us.
So as a technical sergeant, E6.
I served in Vietnam in 1969.
I am a U.S. Army veteran.
Have you ever helped a fellow veteran?
Of course.
Yes.
Try to always be there for each other.
I do my best reaching out to my brothers and sisters in arms. Have you ever asked for help yourself?
It's always tough, right?
I can't say that I have. I mean,
If you don't have someone to kind of help you guide those thoughts, it can be really bad.
eventually, you just can't deal with it on your own. I guess it's a part of the military too, right? Service before self.
It was drilled in, service before self.
And you start to question, maybe people would be better off without me, When you realize that you're not alone, once you take that first step, there's so much support.
Thank you. So again, a common theme that I think you've heard throughout what I've shared with you today is take that same message and put it where your audience is. So an example here on how we leveraged social and tech is we partnered with Twitch and hosted a 2-hour event that was, done with a streamer who was a U.S. Air Force veteran, DJ, I think his name was DJ Knight. And, we had over 420,000 views of this content. It was over 2 hours with about, on average, 11,000 people concurrently viewing it. And he shared his own experience while he played his game. He talked about how difficult it was transitioning back into civilian life. He promoted the resources at va.gov/reach. And again, meeting your audience where they are. And the website here is pretty extraordinary too, because it really speaks to what veterans are going through emotionally or what they're experiencing in their life, so that they can then search and find the resources that are available through the VA, that when you go to the VA site, sometimes they just feel like, this isn't talking to me, I don't have a mental health issue. It's really about life and how I'm feeling. And again, we're measuring impact, and we've had almost 4 million visits to the site. Almost 8 million veterans are aware of the campaign, and 2.8 million are currently struggling and aware of the campaign and have actually reported reaching out for help. So quickly, I'm going to talk about our newest campaign, and it's probably one of our largest, which is focused on the adult population, roughly 18 to 49, skewing a little younger, skewing towards Black and Hispanic men in particular out of the gate, but we're designing content for many audiences that really fall into a certain category. They self-identify as struggling with their mental health, have substance use disorder issues, and some of their attitudes around mental health and taking care of themselves really are getting in the way of them doing just that. So it's important for us to find a way not to just scare everybody, not to just say, why aren't you doing this, but kind of reframing mental health and taking care of it as your greatest asset to be everything that you want to be, how you want to show up for your family, for your community, for your friends, and most importantly, for yourself. So let's take a look at this work.
I wonder if you know that I want the best for you. I know you're going through a lot. I wonder if you know that the big homie needs help too. You can't just rebound from everything. I know you've been grinding.
Let's go, let's go, let's go.
But how long will you fight solo? I wonder if you know that we can get help. I wonder why we waited so long. I'm not wondering anymore. Love, your mind. Let's see how far we can go.
Thank you. So right now we have that available in English and Spanish, and one piece that tested particularly well across all audiences, all genders, all ethnicities within this struggling with my mental health group of individuals was this notion of taking care of you takes care of everyone. And we had just a still of the dad with the little girl on her shoulders. So again, it's about putting your oxygen mask on first, being there for others, but providing it in a very culturally relevant way, and then leveraging tech, digital, and social to drive that message and engagement forward. And we're so excited that we have many partners lined up to support this campaign. We're actually extending it to rural audiences. We just filmed content with a rodeo star and working with other agricultural groups, customizing it in a way that speaks to those individuals. So in closing, I think the theme here is one size does not fit all, when it comes to mental health in particular. Spending time getting to know your target audience, talking to experts, doing the research, doing the homework, designing big, flexible ideas that can really drive conversations from multimedia campaigns all the way down to churches, and we do a lot of work with faith as well. So they have to be big, they have to be flexible, so it's clear, it's consistent, and it's authentic. And I really appreciate the opportunity to share this with you all today, and I'm around if you have any questions and want to learn more. Thank you.